Sometimes the early signs of autism are easy to miss, but early identification of autism can connect children and families to important evidence-based interventions and resources. In this video, we will discuss the importance of early identification and intervention while highlighting perspectives from parents, medical professionals, and educators. We will provide an overview of the early signs of autism and empower individuals to start the conversation with parents when early warning signs are observed. Although this can be a difficult topic, so much can be gained from early intervention, and there are a variety of resources available from local school districts and the medical community to assist families along the way.
So my son was diagnosed at 3. We feel he could have been diagnosed sooner, but we were always told he's a boy, boys talk late, that's how boys are, and we believed them. But in my heart, I kind of still knew that there was something wrong, and I needed those adults to be more truthful. And I know that now. My son is 16, and he's doing okay. I think if he would have had early intervention with more intense, where they really thought there was more going on, so he would have had more services, it would have helped him.
The last 2 years, I've specialized in diagnosing children with autism, especially the younger children with autism. In talking with teachers about the early signs of autism, especially for kids 3 and younger, in that 3 to 5 age range, a lot of the things that I would be looking for is back and forth communication, back and forth play, and then restricted and repetitive patterns of behavior. So a lot of times what I notice, if children only have a speech delay, they will use other methods of communication to get their point across. However, a young child with autism, if they have those communication delays, they might not use gestures or pointing or kind of body movements as a sign of communication. So a lot of times, rather, they'll just take someone's hand and bring them to an object in an attempt to request. In addition, I look for babbling. So if children are babbling, I'm really looking for if they're directing it to someone. So a lot of times kids might make noises, but they're making it for their own benefit, and that would be an early indicator sign of concern. Then I'm also looking for play skills. So how a child plays. Are they playing repetitively over and over again? So especially for younger kids, I'll see them stacking and knocking over and over again. And it's an inflexible play skill, or putting items into a bin and dumping the bin out over and over again. If a child, though, is doing imaginative play or social imitative play, so pretending like they're mowing the lawn or cooking dinner, then I have less concern for autism. But it's when they lack those skills of either imitating what adults or other kids are doing, or that imaginative play. Other areas of concern would be playing with other children. So a lot of times kids on the spectrum might indicate that they want to play with other children, but they lack the ability to initiate or even maintain those play skills. So a lot of times I notice that they'll do what we call parallel play. So they're fine playing next to kids, but they're not really playing back and forth with kids. Then the other thing that I look for is the restricted repetitive patterns of behavior. So doing things over and over again, like taking a ball and dropping it the same way each time, or doing it with other objects, so a block, a ball, a baby doll, that they just kind of do things the same way over and over again, I might be concerned. Sometimes kids have motor mannerisms where they might twist their fingers or have body posturings or tensings when they get excited, or sometimes out of nowhere, pacing back and forth. And then any like body rocking or just kind of complex body mannerisms, if they do it in a repetitive manner. Once or twice is typical for a young toddler to do, but if we notice it more and more frequently, then I would be concerned. And then finally, there's an area of sensory sensitivity or hyper or hyposensitivity to sensory stimuli. So if a child might become really distressed over loud noises or textures, tags on clothing, that would be an early warning sign. But then also fascination with sensory aspects of objects. So maybe becoming really fascinated by a fan that's moving over and over again and not being able to turn from that. Also, there's sensory sensitivity that I'd look for. So a lot of times kids might put objects on their face or sniff or smell them, or even sometimes lick objects. And if they do that in a repetitive manner, then that would be a red flag concern for me. Final thing that I would be thinking of is kind of strict adherence to rules or routines. So a lot of times a routine is good for children, but if we change the routine and then that ruins the next 30 to 60 minutes, then that would be a warning sign, or becoming really distressed if we're taking a different way or a different route to school or to grandma's house or something like that.
If early warning signs of autism are noticed, local school districts are ready, willing, and able to assist families in determining if a child needs an evaluation. Schools may provide screenings for autism as a part of a comprehensive evaluation to determine if a child has a disability. Pediatricians and other medical professionals are also able to provide autism screenings and medical diagnosis of autism. Navigating this topic with families can be difficult. It can be daunting for individuals to discuss with families when early warning signs of autism are observed. But we can support families by providing additional information, resources, and possible next steps for autism evaluations.
I'm here to speak with you today about how to have conversations with parents after a screening for autism has been achieved, because it's really important to identify kids at an early age if they do have this disability. Now, this does not mean I'm giving your child this diagnosis, but it does mean that kids that screen on this really should be evaluated, because the earlier that the professionals can intervene and assist with your child, the better is the outcome. If you have a parent that seems angry or frustrated or in direct denial of your screening, probably the best way to handle that is go back and explain the purpose of the screening. We do the screening as a service, and it is a measure that has been proven to be helpful in identifying these disorders. What I am encouraging you is to go gather a little information. That information doesn't mean you have to do anything with it, but you at least need to go get somebody that does this for a living that helps recognize these children and give you the options from their professional perspective.
Early intervention can put kids on a better path and have them lead a better life. Be the person that can help change that for a child.
We know early intervention is crucial when a child shows signs of autism. Help can be just a phone call away. For infants and toddlers ages birth through 3, a referral can be made to the Early Development Network by calling the statewide toll-free number. Anyone in the community can make a referral with parent permission. For children ages 3 through 21, Nebraska Public School Districts are ready and willing to discuss your concerns. All Nebraska schools have a responsibility to find children who may have autism or other disabilities, so parents should contact their local school or district if they're worried about their child.